Hi, everybody. My name is Martha. I'm a relationship counselor and clinical sexologist. This is a 4-part series, 4 videos. So in the first video, Jacqueline and I introduce ourselves and what we do and why we are so passionate about supporting people with vaginismus. In the second video, I got Jacqueline to talk about her treatment of clients with vaginismus because we want this series to be really, really practical. So we are giving away like what we teach. So in the third video and in this video, I'll be sharing how I work with clients with vaginismus, what's my treatment with clients with vaginismus. In the fourth video, we'll be talking about beyond vaginismus. So yeah, without further ado, I guess, yeah, I'll just start sharing. But anyway, I just want to give Jacqueline's full name is Jacqueline Vanderbilt, and she also has a book called How to Overcome Your Vaginismus. How to Overcome Your Vaginismus, and her website is overcomeyourvaginismus.com.
Yes. The book is for
So yeah,
sale.
it's a very rare opportunity that we have two people who are vaginismus experts, and I call myself a vaginismus expert because I have been working a lot with clients with vaginismus over the last 12 years. So Jacqueline has been doing it for 15 years. It all started with my first client who came in with vaginismus, and I was really excited because I had studied about it, and I I really am very passionate about supporting people with vaginismus, being a woman myself with a vagina, and knowing how that will feel like not being able to please your partner, having the fear of the relationship breaking down, your fear of your partner cheating, or the fear of the marriage, if they're married, ending, and what that can mean to fertility as well, how you can have a child, how you can give vaginal birth if you want a vaginal birth. So these are all linked. And so anyway, when my first client came in and started to work with this client, fortunately, this client had already done some work on themselves. So I went by the book and it wasn't working. So I started to share the other things that I knew that I think could help. And over time, not immediately, over time, I started to realize all the things that I learned when I learned how to have sex for the first time, how to have penetrative sex, was all very, very related to all the women that I work with primary vaginismus, who are at the crossroads. And I call this a rite of passage from feeling like a girl, even though some of them are already married and in their 20s, from feeling like a girl to losing your virginity for those who have primary vaginismus. The only difference between them and me at that point was the fear. They have fear of penetration and they have a big fear of the unknown. So I started to tackle it with what I read, which is the treatment, which is if someone has fear of the unknown and they have lack of sex education, give them the education. So I started with teaching them about anatomy, using sexual aids, getting them to read. And so that's the knowledge part that Jacqueline also was mentioning in the previous session, previous video, the sex education. Then the next thing is they want to do the inserting, and a lot of them may have heard of dilators. And what I found a lot of people do is they are very rough with themselves.
Yes.
They are rough, they are vulgar with themselves, and they are doing things to themselves that I would never in a million years want that to be done to me. And so I started to come up with something very simple. And I say, I never ever want you to do any inserting, at least for the moment, until you overcome vaginismus. I never want you to do any inserting into your vagina when you're not aroused. There's a big difference when we are aroused and we are not aroused. When we're aroused, the blood flows to our genitals becomes engorged, and the vagina starts to dilate. And obviously for people who are virgins, the vagina being aroused, dilated, and lubricated is not enough, because it is like a baby. It's like a baby because they have often never even fingered themselves. They have never explored their body. They have never looked at their own genitals. So looking at the genitals is also another thing that I might share with them. And I call it looking, touching, naming, exploring, and then putting the finger at the entrance are all small steps towards overcoming vaginismus. Then I
And do
talk
you
about my,
can I
yeah,
ask a question? Because do you
yes,
also find out that it is really easy to say to them, look at your vulva, or look at your the outside, yeah, I call it the vulva, is but for them, even to look at that part, many women who come to me, they are really found it difficult even to look at that part. So
Yes.
even that kind of exercise, sometimes I have to do really in pieces that kind of exercise, and I
Yes.
found um, it's so sad that so many women
Don't look.
are
People
too
look.
afraid to look at their
Yes.
own
And
body.
depending on what they are feeling, their reaction is going to reflect the way they feel. Meaning that if they already have a fear and a disgust and inhibition around their genitals, they are not going to have a good experience looking at their genitals. So I have to prepare them even when I invite them to use a mirror and look at themselves. So I'm very careful with that. But I start off with the head knowledge first, because that is the place that most of them are at when they come in. So by understanding what is actually going on and what to expect, the kind of pain, because they are thinking that all pain is bad, when actually pain is our body's way of telling pay attention, and it's within our control to stop and to slow down. So when they understand that they have the space to stop and slow down and to have the confidence to be able to speak up and to communicate with their partner, then that is one of the steps to overcoming vaginismus. So I talk about looking, touching, naming, exploring as all small steps. And I also talk about progressive steps. I also talk about the different options, whether it's from using dilators, which some people are completely against, to using your own fingers, or using other things like a small bullet vibrator, whether it's on or off, or even something as simple as a cotton bud. So a cotton bud, you can use a condom and you can put it over the cotton bud. So these are just giving them options and also answering their questions around like whether they should use a lubricant and how they can find out vagina, and also demystifying some of the concerns that they have, like, oh, but it's so small, or oh, I can't find it, or oh, I don't see how. So being able to answer all of their questions from the head, then giving them exercises that can do progressively and slowly. One of the things that happened to me and also to most of my clients is that our genitals are very, very sensitive. It's full of nerve landings. We are meant to feel. And when we feel pain, some people freak out because they actually assume that it's not supposed to be painful. And they also associate the pain that they're feeling as, that's it. That is the painful sex the first time people will have. And so they are not ready to go and experience the first time pain, thinking that penetration for the first time is always painful, when actually it doesn't have to be the case. So this is when I give them knowledge, and then I give them the exercises, and then I might share my personal story, and I demystify every single one of their protests or every single one of their concerns. And then they start to realize, oh, it's not true, because a lot of what we hear is urban legend, and it really doesn't help when we are a society that doesn't really talk about sex openly. When they do talk to their friends who also have painful sex, then it just simply verifies, validates that this is how it is. This is the curse of being a woman, and they haven't heard positive stories about sex. And I feel it's so important that they hear it from somebody who really loves sex, enjoys sex, and advocates for positive sexuality.
Yeah, it's so nice how you talk about it, because many things you do, like explaining everything, I do the same. And but I think what I also heard, what I found really important is that they can ask you all kinds of questions, and they dare to ask you questions
I have them.
that
Yes.
that they don't dare to ask anybody else.
Yes.
And that is so important, because then you can explain the real thing about it, not the myth or the legends, but the real things about it.
Yes.
And then some people who watch this video, maybe they think, those women don't know all those things? But many women do not know
And
anything
don't know this
about
either.
about- yeah, many women, yeah. So
and
it's
and
really
and
nice
and yes, and nowadays with the internet, even though there's a lot of information and a lot of websites, people also don't know what to believe. So it's really important to go to people who have done the work, who know what they're talking about, who are experts, who have worked with many, many clients, who have the credentials, who have the testimonials. It's so important because there are lots of people also out there trying to make a living.
And what I also like about you is that, because you have the background of really love sex, then some people say to me, yes, Jacqueline, do you talk about that you love the intercourse in the whole spectrum of sexuality? And do you talk about it? Because it's a bit, it's not so nice for the woman. I say, yes, of course I talk about it, because if it's not nice, if I cannot enjoy it, why should they learn it if it's not enjoyable? And because you're so, the way you talk about it, it's so nice and lovely and soft and gentle. And I think that is what women need to know, that
Yes.
sexuality, that intercourse, and with the man or the partner who you're with, and I hope it's a nice man who you are with, it's a nice thing to do, and it's a gentle thing to do, and it's a lustful thing to do. And that's what I like about what you talk about, because
Mm.
many women, they cannot imagine, because it's hurtful to try something in the vagina, they cannot imagine that intercourse would be nice or
Yes.
joyful.
Yes,
And
so this is, yeah, so this is where I start planting seeds and tell them that why would so many people around the world want to
exactly.
have sex if they're always having pain? So this is exactly what they need to hear, because we need to think of a life beyond vaginismus. I don't want clients just overcoming vaginismus and that's it. You know, it's about pleasing their partner and giving their partner what they want. It's also about them being very aware that this is their choice and this is actually something fun and enjoyable and pleasurable, and it doesn't have to be painful, even though I believe that most women have experienced some form of pain with penetration. However, it is a lot of times it can be prevented with some basic sex education. Just because pain is common, it doesn't mean that it is supposed to be like this, especially for people with vaginismus. So because of all that, after 5 years of doing my practice and having so many people around the world contact me, especially around Asia, from Malaysia, from Thailand, from China, from even from Canada. So I created my online training program called Sex Possible, and it is eroscoaching.com/sex dash possible. So I have an online program for that, but nothing is the same as working with someone face to face, because as you mentioned, it's very important to follow the woman's journey. Because if she has questions in her head and she will be like, you're saying this, and then she's like, but, you have to address the but, because all the things that are in her head are stopping her from really listening to all the other things that you have to share. So it's about addressing them. So this is the reason why at any point when they want to ask anything, it's so important to just stop. It is more important to meet them where they're at, to answer all their questions, to demystify the misconceptions, because that is the real question. That is the most important thing to address first. Not what I have to teach or share, is what they have. And it's so important to address that with them. And so this is the reason why the results of private sessions are a lot more effective than reading a book, than an online program. People who have the time and the finances, because we do need to be paid for our time, we do have bills to pay as well. I feel that what we have done is we have provided our expertise because we want to help as many people as we can. But in my personal experience, I still feel that private sessions are the most effective. Is
I feel,
yeah.
yeah, for me it's the same. But when uh, many big people buy the book and then they come for one or two, or maybe for the whole sessions, different sessions for doing the book reading. But I agree that the personal sessions and the knowledge you can give, it's really different when you read the book. But what I found it's nice is that what I hear from my clients is that because they read the book, they get a little bit to know me, who I am, and how my treatment is, and then they can take the step. Is that the same with you, with the problem you have?
Yeah, so this is the reason why I have about 700 videos on YouTube by now. It's because I had so many clients who were so uncomfortable to come and see me. And I started making these videos because there are so many people who are asking me the same questions all the time. And I really want to leave a legacy of being able to help as many people as I can. So the face-to-face is something that is very valuable and customizable and personalized. However, in order to reach more people, I knew that I needed to have a more public platform. So a lot of my clients who are coming in now, they are not saying these things anymore. They are not saying, oh, I don't want to be here. Oh, they drag me, and giving me face, basically being quite rude. Now I don't get that anymore because they actually did their research. They watch their videos. They feel like they know me. And then when they come in, they don't have that kind of shyness as when I first started. So we just get straight into business and we just talk about what's happening. And every session, even if it's just 1 hour, is actually extremely productive.
Yeah, that's. I think that's it's sort of similar in our treatment, and it's really nice that we can help in this way. We can help so many other women.
Yes, and I'm glad that your book has English translation now, and also you are more active in getting yourself out there so that you can help more people. So, okay, this is video number 3 of Martha's treatment, and be sure to watch the other videos. So, in the next video, video number 4, we are going to talk about beyond vaginismus. So, what is life beyond vaginismus?